Welcome to Washington Policy on the Go. My name is David Bowes. I'm the Communications Director for Washington Policy Center. And this is the show where we come to you every other week during the off legislative session months, bring you the latest in policy news and our research updates, occasionally a special guest to talk about the impact of how state policy decisions are changing your life and the way you raise your children, educate your children, build a business, build a home, maybe get your health care. We talk about all of those things. This episode will be focused with our one center director, and that is Elizabeth New. She heads our education and worker rights departments, and we'll speak with her in just a second. I do want to remind you.
Healthcare and worker rights.
What did I say?
Education.
Well, there you go. Educating you on healthcare is Elizabeth New. And it's one of those things where I want to remind people, if you have any questions for Elizabeth, feel free to put them at any point in the Q&A box at the bottom of your screen. Do that, and it's the easiest way to reach. Try not to use the chat box because it's harder to see the chat box just the way the studio is set up here. And it's easier to keep track of which questions have been asked and which haven't. And if we run out of time, or if you think of a question later, you can always email Elizabeth directly. Go to washingtonpolicy.org and go to the staff section, and her email is right there. Or you can email me directly, and I will forward it to her as well. We have a couple of exciting programming notes, some guests coming up this summer. So be sure not to let vacation schedules slip by. And if you do and you're gone during a Washington Policy on the Go, feel free to catch up on YouTube. Our YouTube channel will have each episode in full, and you'll be able to catch up there if you're gone for any reason over the course of the summer. And heck, I hope you are. It's good to get out on vacation from time to time. But Elizabeth, let's start our conversation. One of the things that you brought up is that what we really need is for people to pay for more people to be paying directly for healthcare. Not more people to be paying more for healthcare, but for more people to be paying for healthcare. Now, for a lot of people, they hear that and think, what is wrong with you? People are paying too much for healthcare now. Why would you say that more people need to be paying for healthcare?
I think one of the biggest problems with our third-party payer system, whether it's the government or an employer paying for healthcare bills, people really aren't aware of the cost. They aren't aware of what things cost or what they could shop for. And we need a healthcare system where more people, not fewer, have skin in the game, where providers are competing for their dollars with quality and price. And people have more choices, and then they'll have more providers offering value to them. I think competition is the solution, and less third-party payment.
Offhand, I know people used to pay, for example, directly for primary care. That used to be, basically it was a cash service. My grandfather used to trade for primary care. He used to cut blackberries and stuff for the doctors that served his family when my dad was growing up. But that shifted to, it's under insurance. Everybody's got a copay, and nobody's really sure how much the office visit is really going to cost and all that. How did the shift happen, and how would you envision, a return to that happening?
That's funny you mentioned the barter system that used to be kind of primary among a lot of people. My dad was a dry cleaner, and I remember he traded dry cleaning services for dental care, for health care, and several things just went on the side. I have a broken finger still that looks funny because I never got it fixed. But I don't think I had health insurance until I was an adult. And part of that shift is because of the government taking on more and more clients that it serves. It totally distorted the healthcare system. Transparency is not primary. And some of the things that we need to return to, I would like to see high deductible health plans and people using HSAs, health savings accounts, by which, you have insurance for catastrophic needs, just like you have car insurance for the biggies. You don't have car insurance to change your oil or to put fuel in your car. We would return to that kind of model. And a lot of the HDHPs do have preventative care within them. So I think that's a model that could really do wonders for us. And then if you're spending your HSA money you've set aside for healthcare, you're shopping for the best rate. Right now, we don't shop for the best rate in healthcare, most of us. We just go places we're told and don't care about the cost. It's a huge shortcoming to having competitive pricing in the healthcare market.
Yeah, I mean, the most you're going to do is find out if it's in network, so to speak, because
Right.
eventually, if you have time, you're going to try and find that out, or if it's a major surgery of some kind where you could end up paying more, you might do that. But even that exercise is really indicative of why pricing matters. If you know something is going to be twice or three times as much because it's out of network, so to speak, you start shopping somewhere else, that's an indicator that people respond to prices. And really, the whole capitalist system is based on information. Pricing is information. I remember I worked with State Senator Phil Fortunato for a while, who was talking about having a surgery that he needed, and he was shopping around for it, and he kept calling, asking how much X, Y, or Z was, and nobody knew the answers. And then finally he would get an answer, and it went from somewhere around $35,000-$40,000 a surgery to about 7,000. And to me, that's just a really big indicator that huge savings are there waiting, but systemically, we've got a huge inflated, bloated approach to healthcare that's making it cost more for everyone. And the free market kind of gets the bad mark for it, because people say, hey, we have a free market healthcare now. Why would, it's not working so well for me, so why would I be afraid of, say, a universal government only care? So
Yeah.
answer that question. Why should people be concerned about universal government only care?
Well, first of all, it's one of the biggest myths out there that we have a free market in healthcare. We do not. We have this crazy hybrid system that was brought about by Affordable Care Act is the most recent part of that, but there's not a free market in healthcare. And the reason we should be afraid of a universal taxpayer finance system is because everywhere else they're tried, they bring rationing and wait list. And the demand is always bigger than the supply. So if you're one of the lucky ones, great. But we've got delays in care for even emergency services going on in the UK and Canada. And people who have money leave those healthcare systems and come and get care in America or in other countries. So, there's a two-tiered system either way. You've got people still in these systems where you're supposed to have universal care, leaving to get actual care.
Is there a state or is there a place that you can point to that is practicing more of a market model of healthcare, so that, people are paying directly for healthcare, or maybe people are, they have the kind of emergency coverage for those expenses that are they'll bankrupt anybody, but they're paying the rest of the healthcare themselves, or they're paying cash for other forms of healthcare that's really making a big difference?
I know models that are working, direct primary care models throughout many states. And one I always like to point to is the Surgery Center for Oklahoma. They are a cash-based model system with transparent pricing. Even I think they do take some insurance now, and I know some people find it cheaper to fly to Oklahoma and go to the Surgery Center for Oklahoma for a knee replacement or something than it is to go through their insurance in their home state. I got a total knee replacement a few years ago, and I can't imagine being in another state for the recovery part, but that's aside from the point. But pricing in our healthcare system is muddied by all the cost shifting that's going on. There's so much cost shifting. Medicaid does not pay its way. And in Washington State, we have 2 million people on Medicaid. So 1 in 4 people are on Medicaid. And when 1 in 4 people are not paying their way, the state is not paying their way for them, saying we have all these, we're taking care of all these people, but they're not. The hospitals are shifting the cost to commercial payers. So our prices are inflated if you're paying in a private way. And that's part of the huge problem right now.
Yeah, I'm glad you brought that up because that was a follow-up question of mine where people, we did this when, you know, we just had the largest tax increase in history pass our legislature, and it wasn't even close. It's just huge. And I was pointing out to different people that it's the largest tax increase in history, but but even that is not the full extent of the increase because the 6 cent per gallon gas tax, 12 cents on diesel wasn't included in that, nor were different rules that pass costs on to somebody else. Like if you pass rent control restrictions in order to keep people in a facility and it ends up costing the provider a lot more money, the state is providing this quote unquote service, but it's forcing a third party to pay for it. And it's something similar with healthcare where the state, you know, you can flesh this out, but the state does something where they cost shift the prices for various things. And they say, well, look, we're controlling costs for healthcare, but they're not. They're not changing the costs, you know, or reducing costs. They're shifting the costs so that now the tax is hidden because the private provider has to pass it on to what the other 3/4 of the state that is not on Medicaid, so that they can make up for those costs. And that's why you see the ever escalating costs elsewhere, and why a lot of hospitals are, you know, teetering on the brink of financial collapse because they're just not getting paid.
Yeah, I'll give you 2 examples just from this session. You know, this year, the Washington State Legislature passed Senate Bill 5083. It capped what hospitals can charge for services that are provided to government employees and other people dependent on who receive health insurance from the state. And that might sound good on paper that it lowers costs for the state and its employees, but it means someone else has to pick up the slack. And that someone is private insurers. Another example is House Bill 1392. The law was pitched as a fix for Medicaid underpayment, and it aims to increase Medicaid reimbursement levels to at least Medicare levels, which again is a laudable goal. But, you know, it funds the increase with a new covered lives assessment, a per enrollee tax on private health insurance plans. So it forces the private insurer to pay more, so the government can say it's paying more, and it's not. It's cost shifting disguised as reform. And you know, if the state is going to be the healthcare insurer for millions of people in Washington, it has to pay its way. We can't just feel good about ourselves for offering more insurance, taxpayer-provided insurance. We have to pay for it. And so I think part of the answer for this is tightening eligibility. You know, we are an expansion state. Medicaid used to be something that went to low-income adults with dependents, disabled, elderly people. And in about 2013, I think the state expanded to cover low-income adults between 19 and 64. And that's now 30% of the Medicaid population. So when you hear things about these federal reforms talking about work requirements, they're talking about that group, that population group. And when they're talking about lowering the federal contribution, it's for that population. It's not for what we think of in the traditional population in that way. So there are a lot of things that have added up the cost for this. You know, in 2013, I think we had 1.1 million people in the state on Medicaid. We have now nearly 2 million. We were up to 2.2 million when the government during the COVID era was not requiring redetermination for eligibility. So a lot of people were still on Medicaid, the state's paying for these people, but they now have the ability to get government-provided health care again, or they have incomes that went back to levels above qualifying for Medicaid. There's also an issue of 2 states paying in on one Medicaid enrollee, and there's efforts to discontinue these concurrent payments, which is what they call them, and we don't seem very interested in them. And there was a bill in the state legislature that would have helped prevent concurrent payments, 2 states paying in on one enrollee. Taking away one of the states would have no impact on the enrollee. But I heard the argument made that, oh, it's not going to save as much money as we think. I say save every penny you can find. You know, the more we save and tighten up on eligibility restrictions, redeterminations, and that we can spend on people in need.
Yeah, that was one of the more bizarre bills because I didn't see any. I mean, I couldn't foresee a challenge on from either party or any elected official saying, "Hey, it looks like there's some double payments being made. We can eliminate one. It doesn't impact the person who's receiving the health care because obviously it's a double payment." The only thing I could think of is somewhere somebody counting somebody doing the research must have discovered, hey, maybe Washington's benefiting from more double payments than we're hurting. Who knows? But still, it seemed like a no-brainer kind of reform to me on that. How would you rank the past legislative session in terms of healthcare interference? How seriously do you think that the past session has changed has it changed the market, so to speak, in Washington State? I mean, I know we were on the wrong path anyway, but how do you rank it? How do you look at it? How would you assess it overall?
Well, there's just a continued push to control the market, to put price caps. This last session also, it's hard to rank because I am trying to think of all the other years at the same time. But I think it's just another really bad year. You know, the state not only passed those 2 bills I mentioned, they passed another one about medical debt not being able to be reported to a collection agency. So eliminating some of the ability to get repaid for medical debt. And again, the costs shift. If people aren't paying their medical debts, the cost shifts. It still has to be paid for, these services. So that was another one, one that isn't impactful really, but it's a message sending bill with Senate Joint Memorial 8004. And that one was a letter to the government, the federal government, asking it to enact universal taxpayer financed healthcare or let the state go it alone. And that is the direction the state is headed. You know, they've set up an ongoing, never-ending universal healthcare commission to find a way to get us universal healthcare. And many of these bills are influenced by that work. You know, and sometimes in my more cynical moments looking at the session, I think, oh, they're going to drive us to be begging for universal taxpayer financed healthcare, because at some point that cost shift is going to become so bad when we're all paying 200% our actual cost of service because we're paying for someone else without them admitting we're doing this. You know, and they don't argue this. They don't argue that Medicaid underpays. In fact, the state law, I think in 2024, required the health care authority to direct that a minimum payment for services on Medicaid could be no less than 65% of the cost. You know, and that's just an admission that we are vastly underpaying. And, you know, the state takes bows and wants congratulations for its expansion groups and for adding people to Medicaid, and we're not paying our way.
Yeah, it's always confused me how that's even legal. You know, you're
Yeah.
paying people back for their services without actually paying the full amount. If you apply that logic to anything outside of healthcare, I think, you know, mechanical services or computers or something, right away people would say, wait a second, what? The government is buying a shipment of computers for you, but refuses to pay full price. They're paying the market price. They're paying 65%, and they're telling you to eat the rest, you know.
Right.
Isn't that theft in some way, you know?
And hospitals are in a huge bind, you know, it makes sense to me why they're super scared about some of these federal reforms. You know, the state has created dependency on the federal government for its Medicaid program, things like provider taxes, you know, it's relying on increased payments so it doesn't have to pay its way in this federal state program. And if the federal reforms take the percentage of match away from expansion population or put caps on provider taxes, we have a huge problem. Hospitals and providers are already underpaid for Medicaid clients and even Medicare clients. There's debate about how much of an underpayment. It's not as bad, but 2% in some cases, not in other cases. So, you know, hospitals are in a bind. They have told the legislature very clearly that if the state passed these reforms that it passed this session, it would either have to cut programs and services or close hospitals, or it would need to shift the cost higher onto private payers. So one of the two or a combination of both is going to be happening.
Frustrating because people, you know, they don't know what they don't know, and people tend to forget how things were or are, and they just see things as they are and wonder, you know, what they forget what went wrong. Like, you know, 10 years ago, Obamacare was going to fix all kinds of problems with healthcare. It was going to be less expensive. It was going to be easier. And you don't see a lot of that. And there's instead, you know, I've noted that waiting, you know, there's a lot of talk about doctor shortages and how doctors would get out of the profession or retire early. And, you know, it's hard for people to find primary care providers. It's hard to get appointments right away. Now, it's easier under some models like, you know, the what's it, concierge, where you pay the primary care provider, you know, a monthly fee,
Yeah.
things like that. But so there are groups of people kind of working around the rules, but overall, there's been a lot of new challenges to healthcare, and none of them have been very good. There's a question from the audience: have state laws limited the number of insurers in Washington, in your view?
Not in my view, but I know the insurance regulator approves or doesn't approve insurers in our state. So yes, I would say the number of insurers is limited. I know that speaking of insurers, already we know that they're going to be asking for rate increases of about 21% was the average. 21%. That won't be what's approved by the insurance commissioner, but that's what they see as needed to help cover their costs.
Question from Ben. In the old days, we had more healthcare types. Now I'm lucky if we can get an appointment within weeks rather than the new normal of months. I read we're 135,000 MDs short by 2030, and RNs are just as needed. Competition's over. It's more of, can I even get an appointment? I strongly agree government-run healthcare is going to be worse than what we have. Ben is a retired, very retired, he says, MD. So he might be forced out of retirement, judging from that shortage.
Please, please. No, it's true. The shortage is real. And that's what I think states need to be going after is workforce enhancements to help people drive into these careers and places, and residency needs to be looked at. There's a lot of that. And you know, I'm scared about the wait times people are having to wait, because in part that's one of the greatest arguments against taxpayer financed universal health care, and I'm afraid it's going to become one of a little less of an argument I can have if we keep seeing the doctor shortage take the options away from people to be seen in a timely manner. But yeah, there's a huge shortage.
Well, I mean, just remember, if the universal system or a government-only system took over, we'd have the same pool of doctors. So whatever the wait is now, it just becomes worse there because they've got the same they're going to have the same limitations. You know, it reminds me of Sally Pipes, who's a prominent healthcare researcher. She always brings up, you know, the wait period, you know, for her mom and for the cancer diagnosis she had, and it was, you know, sometimes you can wait and it's not a big deal, but that was one of the challenges she said with the Canadian system is everybody was really excited about the Canadian system and is really happy with the Canadian system until they get to the point in their lives where they need it. And then they're frustrated with the system because for the most part, for a lot of your life, you know, you're not as involved in the healthcare system as you are later. And when it was needed the most, that's when it was most problematic. And
Yeah.
that's part of the challenge. Sid asks, how should the Medicaid program be reformed and what can the state legislature do?
The state legislature can do a few things. One of the things, of course, I want them to do right now is deal with concurrent payments. That's an easy fix, not easy. It'll be hard, but it's one of the valuable fix that won't impact enrollees. You know, there's no reason to be paying double payments on one enrollee. And I want us to expect more of Medicaid enrollees. They're getting free health care. You need to determine that you're eligible once a year, twice a year. You need to go through these ropes to get that free care. And, you know, that's one of the things that we resist. And that's one of the reasons the Congressional Budget Office and others say people are going to lose health care if we have these reforms. But it depends on several things about people doing or not doing things to maintain that care. One of the other things I'd like to see in the state and all over the nation is eliminating or going after more state recovery for long-term care. Medicaid has become the payer for long-term care across the nation. They pay for most of the costs. And sometimes these are people with million-dollar homes and assets that don't count toward the eligibility mark, whether you can get this care. And a state recovery is not pursued as diligently as it should be. I think that recovering is a huge area of savings. You know, I don't want to kick anyone out of their homes, but if you've got $1 million home, once everyone in the home is passed on or deceased, you know, getting that money back to the state for all the money put into long-term care services is not a bad thing. You know, we should be financing our long-term care, not expecting taxpayers to do it for us. And that's, you know, that rolls into WA Cares and what's going on with that. But Dave, can I move my computer because my extension cord doesn't reach? You
Yes,
can keep talking while
yeah,
I do
by
that.
all means, you take a move. I will remind people that our YouTube channel holds all of the full episodes of Washington Policy on the Go. So if you miss an episode or you want to catch up or share it with a friend, you can go to the Washington Policy Center's YouTube channel. If you get lost, can't find it, just go to our homepage. We have links to all of our social media channels and you can find it there. And you can also check out our latest events and of course the work of all our center directors. If you don't subscribe to our weekly newsletter, which you should, and you should have your friends and family members do so as well, you can always go to our website, washingtonpolicy.org, and see the latest from our center directors there. And that'll work out just fine for you. It's great information. Our weekly newsletter is free. Of course, we hope that it inspires you to be a part of Washington Policy Center, because if you value research and holding elected officials accountable and making sure that people understand and know the results of what state policy is and how changes have impacted it and the ability of people to have a business, keep their business going, to raise their families, to buy their groceries, all of those things, we hope you'll support Washington Policy Center in any way that you can. And collectively, I think our voice is amplified and more powerful together. All right, Elizabeth, there's a question from an Elizabeth. She asked, is this discussion excluding tribes and critical care hospitals? I'm not sure exactly what she means by it, but maybe it doesn't encompass everything. Less exclusionary, more not necessarily comprehensive in all things. But go ahead, you answer.
I don't know how to answer that. Is this conversation exclusive of that? I believe in you said tribes and what else?
Critical care hospitals.
Critical care. No, I think that safety nets are important, and I'm not hoping for any reforms that hurt them. I know that some of the bills passed did have carve-outs for rural hospitals or hospitals without competition nearby, and that's great. But even still, I think going down the path of more micromanagement of the healthcare system is the wrong way to go. And I have to apologize again for moving. I'm
It's
sure
all
you
right.
guys can relate. I keep my little laptop on a pillow sometimes and it falls off and then it breaks the little the charger and then I have to order a new one. This has happened like 3 times. You'd think I'd
Well,
learn.
I was about to say, after the third time, I think that's all on you now.
It
Can't
is.
can't avoid that. Um, let's see. There is we pointed out that the big beautiful bill, so to speak, well, it went through Congress. The Senate's taking a look at it. There's some big challenges there for states, and some hospitals in our state and some lawmakers and policymakers that are paying attention to such things are kind of freaking out as far as what the impact of this bill could be on healthcare in the state of Washington. And part of it is because they've been mismanaging the healthcare in the state of Washington, and now that can come to light. They don't want the consequences of what it is. So describe why, what problem the bill presents Washington State and what we could end up facing because of it.
Well, I get why they're freaking out. And like you said, it is because we've been mismanaging the program. If it's reformed in a way that limits provider taxes are things that hospitals or healthcare facilities pay to the government, and then the government uses them to get double reimbursement from the feds to go back to the facility. And so in a way, it's helping pay for that underpayment that originally exists when it comes to Medicaid services to a Medicaid client. So we're already underfunding. Take those away, one of the only things helping the underfunding. And hospitals are scared, especially hospitals that have a high Medicaid population. There's only so many people to pay, and there's not as many people to cost shift to when you're a high Medicaid hospital or health facility. So that is something to freak out about. I think that we're going to see, I don't think Washington State will limit the expansion population, or, they talk about lowering the FMAP, the money you get for having an expansion population person on Medicaid. I don't think the state is going to adjust to federal reforms that are proposed. I think it will want to keep all its programs in place. And what that will mean is either a higher tax burden for Washingtonians or reduced services if we decide not to pay for those services.
And I'm with you. I think the state would be very, very resistant to change how I'm going to use their term generous that they've been. Again, it's generous with the third-party payers because the state isn't necessarily paying directly for anybody extra. They're just shifting the costs onto other people and getting that done, and then taking credit for helping those people. But some of this could present some real challenges to hospitals as well. I mean, because there has to be give in one direction or another, because hospitals are stuck dealing with the reality. Ultimately the bill is going to stop with them. So there could be some real serious issues coming up from that, I think.
Agreed. And many bills this session that either had to do with requiring mandates for some sort of coverage, or increasing taxes, or erasing medical debt from not allowing it on credit reports, or this cost shifting in other ways. I can't even remember all the bills now. They showed up again and again and said, we can't absorb these costs. And they're saying that I think up to 85% of them are running a deficit, and they're all overall in trouble, and they see it getting worse. And they told the lawmakers that it's going to result in more service cuts, more cuts to services that people like and people need, especially in rural areas. You know, there have been closures and cuts the last few years. I don't think it's going to get any better. And it blew me away that lawmakers heard that and still went for these bills. You know, Jeb Shepard, I think from the Washington State Medical Association, I wrote about him recently. He was in a healthcare cost transparency board meeting, and he said there's just a huge, you know, they're getting concerned about the huge disconnect between saying you want to cost containment and to cut healthcare cost, but then you're layering on thing after thing that increases healthcare costs.
Yeah.
That's what's happening.
Yeah. Slightly unrelated, but it reminds me of, you know, I used to wonder how my local pharmacy could stay open, because a few times I went in, people were walking out stealing stuff, you know, and it's such a regular occurrence. The clerks all talk about it. They know it. The shelves are half empty, and you've got a bunch of bankruptcies among various pharmacies. You know, my own is closing down and moving off somewhere else. And you look at it and think, you know, I know when I was growing up, I didn't see so many pharmacies with boarded up windows, and I didn't see that happening so much. But there's so many different layers and influences, and that are increasing costs and disrupting basically civil society. It's difficult there is no one stop place to fix it. There's multiple problems, multiple policies that are causing additional problems. So,
Absolutely.
hey, I had a question before we run out of time, and we have some great questions. Richard and Robert have some great questions. I think I'll have to email, for those of you who are left over, some of those questions to Elizabeth to get them in on time. But I did want to address your other portfolio, which is worker rights, because this month is the 7th anniversary. I think I got that right. 7th anniversary of the Janus decision at the Supreme Court of the United States. That's where the Supreme Court decided that, yes, you have a First Amendment right not to, if you wish, not to join a public employee union. The government cannot come along and say, you must join a public employee union if you have a job with the government, because you have freedom of association and freedom of speech. And we had Mark Janus speak at a Solution Summit at one point for Washington Policy Center. He was the plaintiff in the case, and talked about how his union, he disagreed with their spending priorities, and they said, well, that's not political. And he said, well, it certainly seems to be wildly political. There's lobbyists all over the place thinking it's political. So we have this anniversary. How do you see it impacting Washington State, and what would be left to do? What's a couple of things that are left to do in Washington State, so to speak?
Well, you talk about Janus. Well, you know, getting public employees to know they have a right to join a union and a right not to join a union is something our state should be concerned with for workers. It's the right of a worker, and we should be very open about that ability. I worry about our politicians doing favors for unions. Recently, this last session, we saw them create basically a strike fund for people who strike against their employer. And they're not doing things with the worker exactly in mind, more unions in mind. And you know, the 7th anniversary, I'm still surprised every time I run into someone who doesn't even know about this court decision or their right to join a union or not join a union. And I've looked around at state resources that are given to employees, and there isn't much out there about Janus rights. You know, there's a lot of information about what your meal breaks are, what overtime is, and how you can get in touch with the union you want to join. But there's nothing that really makes it clear and visible in a big way about your right to not join a union. So I'd like to see that change in the state.
Yeah, and there's also when they're giving the information about to join and so forth, that's on the taxpayer dime, because that's allotted time where they get, you know, people are paid in order to hear this information. But the same is not true of the information saying you don't have to. This is not something that you, regardless of whatever social pressures there are, you do not have to join, and you're not going to be penalized. There's not going to be costs for you associated with that. It's up to you. And then you look at work trailer posters. The one right of workers that's missing from the poster is the Janus right, which is strange to me, considering it's, it's labeled worker rights. These are the things that are important to you. And yet here's the one where the state's kind of openly said that they don't want people to know about it. They don't want people exercising it. They're not going to help it. They're going to try and stifle it. That's why they have windows in which people can, opt out or not, even though, generally speaking, the First Amendment's the kind of thing you should be able to exercise whenever you want.
Yeah, more information I think is key here and should not be controversial,
Yeah.
and these windows you speak of, you can only opt out of a union. They've created layers by which you really can't get out at any time of the year, which you should be able to, once you notice you're paying for it. That's another issue. A lot of governments withdraw the money from your check for the union, and oftentimes public employees think that's just part of what's required. And the government is taking what it needs to take that it's required to take from your wages. So I think, getting the state out of the dues collection game is key. I don't think that'll happen in this state because of our political makeup and friendliness toward unions, but at least the information, getting the information out there. And we're going to try to be getting out the information more by making available one of those workplace rights type posters for government employers that just lets people know they have a right to join or not join a union. So I hope that'll be helpful. The Freedom Foundation works on this issue full time. And I learned from this week that from an article they wrote that union dues can typically be canceled during one of three key time frames. The annual opt-out window that they pick, the anniversary date of when an employee signs a union membership form, which sometimes they don't even know they're signing, or when the union contract expires. And they note that on June 30, all worker labor agreements in Washington are happening, which will bring in a new approved contract and offer a time to opt out. So if you've been interested in not paying into a union that doesn't agree with your beliefs, or haven't known how to do that, we refer people to optouttoday.com, which kind of gives you guidance to do that. And I wouldn't be surprised if right now they have guidance given this June 30 date in Washington State for contracts.
Yeah, that's again is optouttoday.com. Yeah, it's really an interesting issue how that's been kind of buried, and it is a First Amendment issue about association and the freedom to decide, how you want your money applied, what kind of politics do you want it to go to, what the priority of the public employee union, government employee union is not necessarily yours. Janus didn't have an impact on private unions. It was also interesting during that time period. I remember, local media interviewed us, and they interviewed some various public employee representatives, and they were talking about how this was going to destroy unions, and it hasn't, right? I mean, basically, there's two things that happen. One, in some cases, like in Washington, they're trying to curtail the right and squelch it and keep people from knowing about it and making these windows. But the other thing that it forced unions to consider is telling people what the benefit was. Like, just like any other private organization, which they are, they're not government, they're private, they have to tell people, we are worth supporting, and gets the support. And when that happens, more power to them. That's the whole American way, is you convince people to follow you. You don't mandate that they follow you.
And I care about this issue a lot. I was married to an educator for many years, and it's insulting to constantly get flyers in mail that tell you you're stupid and that you're ideologically wrong and that you shouldn't be voting the way that you do. And that is, that was Mark Janus's fight too, is you don't need to go ideological on every issue here. Fight for my rights as a worker, and don't bring all these other politics into it. And that's what happens with many public unions, and what Janus rights were addressing was the right to be free of a union who doesn't represent you ideologically.
Well, thank you for your work, Elizabeth, here. And if you find this show, Washington Policy on the Go, valuable, and the work of Washington Policy Center at washingtonpolicy.org or any number of our social media channels and in legacy media where we get coverage from the research that our center directors conduct, we hope that you'll join Washington Policy Center and urge others to do so as well. Look, Washington State is not going to change when most people that are concerned about it stay on the bench. We need people to get up and make their voices heard, to unify with, make our voices as amplified as possible. And that means, somewhat ironically for a freedom-loving crowd, but collectively speaking, we're louder together. And, the Seahawks shouldn't be the only loud crowd out there. It should be, I think, calls for state accountability, for state reform should be getting louder and louder, especially as it becomes less and less affordable to be here in our beautiful state of Washington. Thanks for watching today. Thank you for coming on the show, Elizabeth. We'll see you all in 2 weeks here with another episode of Washington Policy on the Go.
If you found this informative, share it with a friend and consider checking out one of our suggested videos over here. Make sure you're subscribed so that you can stay up to date with the latest policy news from Washington.